My name is Dr. Chisha Sume Percival, and I'm an obstetrician gynecologist. And currently, I'm working for Meribeg Community Health Services Hospital. This is a hospital that is being run. It's a referral hospital. Should I say it's a specialist referral hospital run by First Quantum. There's more that I have to do as far as reproductive health services is concerned. This particular course, the overall program was dealing with fertility. It's been noted that when you're dealing with reproductive health, fertility is one of the issues that does cause discomfort or and affects most of the couples in each and every community. So Merck Foundation came up with this program so that as healthcare practitioners, we undergo a competence-based training such that even as we are specialists, as we come back as competent healthcare practitioners and offer services that are quite specialized. Then in terms of expertise, all the staff that we interacted with, these were specialists who, I think with the knowledge that they have with the experience, the vast experience they have, and coupled with this multiple success that they have in treatment of these patients, they managed to indeed impart in us all the knowledge as well as the clinical skills that we came back with. So all in all, for me, I did gain a lot. In terms of long-term plans, I'd love to thank Merck Foundation for according myself the opportunity of indeed having the exposure, having the experience of gaining the knowledge, having the exposure of gaining the skills, of which I feel there's more that we need to do for the community out there, especially that if you look at the contribution that the government does offer. Initially, there was little recognition and as well as little support, but now with the awareness that's there, the government at least has recognized that there's a problem and hence the need to give support in terms of trainings that have been offered. Obviously, infrastructure is available. We just have to fuse in the already existing infrastructure such that we continue with the provision of good and uncompromised fertility services. So for now, I hope to continue disseminating the good information. I hope to continue adding to the continued medical education as far as reproductive health is, and indeed continue with the provision of the same service, because I think that's a specialization I have. But I think from an individual perspective, I have intentions of maybe in future coming up with my own fertility center, which will emulate and promote the good health service provision that is given to these particular people in our community. Because I've noted this is a huge gap, which is still a challenge in terms of offering good services. So the time we just completed the course and came back from India, I was in Bangalore. That's the time we started referring this course to our friends and indeed making them aware that in as much as we may think that there isn't support for upgrading our specialist training into the subspecialties that are there, Merck Foundation is one of the organization that is ready available, and I think they gave us the support. They are still out there ready to give the support to whoever I think has the minimum qualifications and entry qualifications. So we started disseminating this information, and we're still disseminating and referring all these colleagues that have an interest, because mind you, this career is not all about training, but you need to have an interest as well as you go to have this training, because when you come back, you need to serve people out there unreservedly, even in the face of resource limited setting that we're in. I would like to indeed thank mostly Merck Foundation for the opportunity of having to the International Institute of Training and Research in Reproductive Health, which is IIRRH, because the skills that we gained, the knowledge that we gained, indeed is quite invaluable, in the sense that as we've come back, we've been able to indeed offer services that are specialized and non-compromised. And indeed, I would like to thank Ministry of Health itself for giving us permission to be part of the team that was selected to train. As well as, after having come back, I'd like to thank all the patients that have been cooperative enough for us to manage them and have good treatment outcomes. Thank you.